important factor in this pandemic. The Atlantic article analyses what it calls an overlooked variable is the key to the pandemic. It's talking about the role of so-called superspreaders, individuals who transmit the virus to a large number of people. The article says an early run of bad luck with a few superspreading events or clusters can produce dramatically different outcomes, even for otherwise similar countries. And there are examples of this. One professional football game in Milan, a church in South Korea, a choir practice in the US where 52 of the 61 attendees became infected. And multiple studies have suggested that as few as 10 to 20% of infected people may be responsible for as much as 80 to 90% of infections, and that in fact many people who have the virus hardly transmit it at all. This is one such paper looking at this, published in July. It found that limiting social activities where many new and random contacts are encountered and in which superspreading events can occur, like at pubs, restaurants, sporting events, places of worship and parties, are likely to have a far greater benefit than closing workplaces, schools and other places where repeated contacts occur among small social circles. Well, Professor Kim Sneppen is the paper's lead author. He's live with us from Copenhagen. Professor Sneppen, we appreciate you making time for us. Given everything that I've just said, do you think these new restrictions that we're seeing in Europe are the best tactic at this stage?
Everything that limits your maximal social activity is good. So you should limit gatherings, that's true. You should also, personally, you should not shop around too much with too many different people. That will help, because exactly as you say, we kind of know that around 80% of us, when we get the disease, we don't even infect our wives, and that's so it's a relatively little fraction that do all the infections, and then they do a lot, and we just need to limit how much they do. So if they don't meet more than 10 people, they can only infect 10 people. And that's much better than if they go to some bars and infect 10 people at each bar. And then easily it becomes a lot of people. So,
but even if you do that, do you not still need to try and identify these super spreaders? How would you do that?
That is damn complicated, because you know about it afterwards. That is where contact tracing comes in, and you cannot really do anything about these super spreaders when they have done their deed, because they are already probably cured at that point, but because everything is concentrated, you can maybe catch the next super spreader by somehow looking into the event that happened.
And as you'll know, there's been a huge amount of attention on track and trace and the problems that the UK has had with it. Which countries do you think are using contact tracing the most effectively?
I don't know. We don't do it very well in Denmark. It's not the way we manage quite well in Denmark, but it doesn't work because of all kind of legal things. I think it is in Asia. Korea did it very efficiently. Especially South Korea, they basically stopped it and they put enormous effort into it. So the Asian countries has better kind of preparedness for this. US had it before they had some in CDC, but it was kind of destroyed under the current administration, is my impression. So they don't really do it. Asia is the one that kind of did it, basically. And Europe has not been very good at this here.
Now, I must ask you about lockdowns and whether they are a good idea. We've heard the Netherlands saying another lockdown may be needed. And then we look at examples like Sweden, which decided not to have one the first time around and isn't having one now. What is Sweden telling us about how to approach this virus?
I think lockdown is too much to do. I think you also, people get tired and they lose respect. A full lockdown would be too much. You need to look at this super spreaders and limit them, and that's basically what Sweden did. The most visible thing, or actually the only really intervention they did, was to say that your max gatherings was 50. And of course that can be limited a little bit more without damaging our life. But making a lockdown where we only go home, that I think it's too much. We know so much about the disease, it's kind of overreacting. We should be able to do it cheaper. But we should be careful when we are in public space. But
just so I've understood you clearly, you seem to be saying that having looked at this virus for over 6 months, now you think Sweden got it right?
I think Sweden got it more, yeah, basically, except they didn't do it right in the beginning. but basically they got it right. Now Sweden has, yes, basically that's the main message. They kind of, what they have done since April, that has basically been right. They didn't do right in March.
Professor Sneppen, we appreciate you joining us. Thank you very much indeed. That's Professor Sneppen, a lead author on that research I was mentioning into the role of super spreaders and the very nature of the way that this virus transmits. Much more on COVID-19, of course, through the BBC News website, bbc.com/news.